Africa faces a growing Mpox outbreak, but international aid lags behind, mirroring the COVID-19-era disparities. With 10 million vaccines needed, scarcity persists. Despite September's vaccine arrival, Africa remains far short, sparking concerns of a potential pandemic. For more on this now, I'm joined by public health expert and director of quality management and clinical operations at AIDS Healthcare Foundation, Dr. Nduduzo Dube. Dr. Dube, thank you very much for joining us this morning on the SABC News channel. And I feel like we're having this conversation for a second time, because the last time we had an outbreak that affected the world, the COVID-19 pandemic, we were having the very same discussion about vaccine scarcity, vaccine equity, and when Africa needs to get the assistance equally so like the rest of the world. Are we back there again, this time with Mpox?
Thank you. You're really saying it right, that it's so sad that we seem not to have learned from our mistakes. You know, there's a saying that says, "Beaten once, twice shy," and we are failing to learn from that. There's gross vaccine inequity, with Africa suffering, or let me say, the global south suffering from huge inequity in terms of vaccine distribution. As we speak right now, Africa needs about 10 million vaccines, but we only have got 280 doses available, which is less than 3%. So I don't know, the world is not learning that if you don't control the disease where it starts, and you keep hoarding these vaccines and putting high prices, the disease will come to you eventually. It's like closing the door and then letting the fireplace start from somewhere. You see it starting, but you let it start, and you still want to hold on to the place and make a lot of money and protect your companies through intellectual property. It's not going to work. No one is safe until everyone is safe. You can't control human interaction. You can't control viruses. Viruses know no borders.
Yeah. I mean, why are we struggling to access, these Mpox vaccines despite global availability?
The global north, Europe and the developed world, they're still hoarding the vaccines. They still want to make a killing. They still want to make big pharma. They still want to make a lot of money from these vaccines by not releasing these patent waivers. I mean, we should have learned from HIV. HIV could have been controlled. COVID could have been controlled if drug prices were or patents were released and drugs were accessed by the people that needed them. We could have controlled the pandemic or the epidemic way before it could have spread to the world. But we're not learning. Right now, the epicenter of the Mpox outbreak is around the Central and East and West Africa. We could be easily controlled if we could provide all those 20 million vaccines that are needed. But as we speak, like I'm saying, we've got less than 3% of the vaccines missing, meaning the pandemic or the outbreak is still growing. It's still going to reach the rest of the world if the vaccines are not made available. Even in South Africa right now, we still do not have the vaccines, but we have cases as well.
And I mean, I guess one begs to ask the question, and I think this is a question that was also asked during the COVID-19 pandemic, is the silence of the international community when vaccine equality simply seems not to exist, even in moments of crises.
It's sad because, like I said, it's so myopic for the developed world to hoard these vaccines and say they will only release them or they will only avail them to their population when the disease reaches them. Yet it was going to be far much cheaper if they could control the diseases from the epicenters where they started, when they provide these vaccines, to make sure that they control the disease before they spread to them. You can't, like I said, wait for the fire to come to your doorstep to start fighting it when you could have stopped it when it was actually starting out. just because you want to protect your companies that are making a killing, that are
So
want
essentially,
to
we
charge
need global
exorbitant prices
action.
for this.
We need global action.
We need global. Definitely, we need global action. We need the WHO to also be putting pressure on all the signatories, all the 196 countries to come together. Actually, there's supposed to be the pandemic agreement, which is supposed to cover all these aspects, where countries are forced to share technology and also release patents to allow these life-saving medications that control pandemics or epidemics or outbreaks to be available to where they are needed, other than just holding them and trying to make the most out of them and sell them at exorbitant prices to the people that deserve to have them. It's not working. Very soon we're going to have a pandemic which is global, and then it's going to affect more people and cause more harm, yet it could have been controlled if we could have gathered together and made sure that we're not protecting any big pharma company to make a killing out of this. Right now, the only available vaccine is too expensive. It costs about $100 per dose. Really, who can afford that in Africa?
Yeah. So if there's a call for global action, which you have done, we clearly need to address issues of fast-tracked vaccine availability, affordable prices, and, I mean, regional vaccine production. That conversation has also been had about, you would recall, some of the trials had been done during COVID-19. I think it was at Chris Hani Baragwanath Hospital in Soweto here in Johannesburg. And clearly, for lack of, I guess, a better terming, Africa always seems to be left on its own to fend for itself.
But it could be simpler if they could allow the technology transfer and allow us to produce the vaccines locally and the cheaper. When we produce them locally, it's definitely going to be cheaper because we've got cheaper labor, cheaper electricity, and even distributing them becomes easier because they are now produced where they are actually needed. That technology transfer doesn't mean they won't make any money from the vaccine. They'll still make money, but they're not making a killing like they want to do right now. So it's simple. One of the best ways to make sure that there is vaccine equity globally to control these pandemics is to allow for the technology transfer and release those patent waivers and also create the medicine patent pools. Like we did for ARVs. You know, ARVs couldn't be readily available until they were produced in India by these companies that produced them for cheaper prices, and this allowed us to access them. If that was done earlier, the HIV epidemic or pandemic could have been controlled, could have saved half of the lives that we lost. But we didn't learn from that. Same with COVID, we didn't learn from that. We still wanted to say, they still wanted to protect the companies that produce, the big pharmaceutical companies to make a lot of money, yet this affects global. They then come with travel restrictions and barring all people moving from Africa. That doesn't work. Most of the time, we can't stop human interaction. But if you use the vaccine, the available technology, you can stop the pandemic from the epicenter where it started. And
I mean, I guess it's too late to talk about how the global community can avoid repeating the same mistakes that were made, during COVID-19. But what role do wealthier nations play in exacerbating or dealing with this issue of vaccine inequity?
First and foremost, the intellectual property rights that they tend to protect stakeholders, multilateral stakeholders like World Trade Organization should also be involved. They should not be seen trying to protect the profits of these big pharma companies only. They should also consider the public health impact of and economic impact of these pandemics. And then that way it will allow these companies to be forced to release these patents to allow this life-saving medication and share the technology with Africa. I mean, this outbreak is in Africa. The epicenter is mostly in Africa. So this is where the vaccine is needed. Whether they have enough vaccine, keeping it that side, it really doesn't help that much. So we need to sit down and have some agreements or laws that will actually force these companies to release this technology and allow production so that we put human lives over profits. That's what we need to do.
And that was a conversation that was had as well during the COVID-19 outbreak. Thank you very much, Dr. Dube. We really appreciate your team getting in touch with us to share such important information with us, of course, relating to Mpox and the availability of vaccines for the African continent in particular, where you have a massive outbreak of this. The expectation, I guess, would be some lessons were learnt from COVID-19, but certainly that has not been the case. Thank you very much.